Hey, everybody. Thank you for all being in the waiting room. Can you hear me? Am I live here? I'm doing the best I can. I am, are we, okay, there we are. Okay, good. I'm getting some responses here. Hello. All right. Welcome. Welcome to the Glock Flock. I'm coming in loud and clear here. I'm in a hotel in Denver, Colorado. Um, and I had to get a hotspot going because the internet here sucks. It's awful, which is not good for a live stream. But it's been too long, everybody. It's been 2 months. I don't know, way too long since the last time I did this and talked to all of you. And so I'm excited to finally get this done. I'm leaving for the airport in a couple hours. I thought, what better thing to do with my free time than to talk to strangers on the internet. And so you're all here. Thank you for being here. A quick update since it's been a couple months, I think, since we've done this. Um, there are like roughly 570 something thousand of you that follow me now that are subscribing to this channel. And I cannot thank you enough. It's still I really can't believe it that you're all interested in these crazy characters that work at this fictional hospital I've created on social media. But it is much appreciated. So thank you for being here. And I will start this off by giving you all a welcome Jonathan head nod. You ready? Okay. See, the key to a Jonathan head nod. All right, you got to get the pursed lip smile. Okay, you got. All right, a little bit of crazy eyes. All right, you got to really show the eyes there, and then you just give the nod. So it's like this. That's the Jonathan head nod, and what it does is it tells everyone that you're here to help. You're also a little bit unpredictable. All right, that's the key to the Jonathan head nod. Thank you, everybody. Let's see. We got Try Zach. I will stay hydrated because that's actually a good point. As soon as I got to Denver, Colorado, which those of you who don't know is like 1,000 or it's a mile above sea level, so it's like 5,300 feet or something. It's really high in elevation. It's like the moisture is just being sucked from my body at all times. I am constant. My eyes are dry, and that scares me as an ophthalmologist. I don't have my artificial tears with me, but and my mouth is dry. Everything's just dry. My skin. It's like, how do people live in this environment? But they love it here. It's really sunny. That's the thing. So thank you, Zach. And then Kevin Slanka, thank you. What are my thoughts on the cry for we need more doctors, but the training to be mid-career? What's I don't quite know. We I think we always need more doctors. I don't know if you're talking about uh the training to be requiring one. Yeah, I mean, it's a long training to become a doctor. But I don't know if you can really shorten the training because it's a lot of things that doctors do are very difficult and they take a lot of time. Like it really did take like 3.5 years for me to figure out how to operate inside an eyeball. It's a little challenging, and then you have neurosurgeons, which are I feel like I think their training now is somewhere between 15 and 20 years of residency. It's roughly plus like another decade of fellowship, I think. So, they're pretty much retirement age by the time they finish. But anyway, thank you for that. So you guys, I'll tell you what I'm doing here in Denver. This is something I wanted to talk to you guys briefly about. Over the last week, I've been very fortunate to do 2 commencement addresses to med school classes, graduating med students. I went to Yale Medical School on Monday, and then just yesterday, I gave the University of Colorado commencement address. Unbelievable! It was both places so fun, such an electric, exciting atmosphere. Obviously, there's been a lot of horrible things that have happened over the last 2 years, and particularly recently. And so it was to be in that environment where everyone is just so happy and so positive, and just the everybody just looking to the future, and you have these students who have worked so hard to become doctors, and just seeing the joy on their faces. And there is really not many things that are quite like a graduation atmosphere. So it was really awesome, a huge honor also, because I didn't know when I was invited to do the commencement address. I was like, how do they choose commencement speakers? And so I learned that the med school class votes. They vote on it, and then they present that to the dean to say, this is who we want. And so I will tell you that I beat out one Taylor Swift. I got more votes than Taylor Swift. That's am I more am I more famous than Taylor Swift? Yes. Yes, I am. I think this clearly establishes that my fame is quite a bit more than Mrs. Swift. And so that was a new kind of thing that I learned over the last week. It's very exciting, very exciting. Now, there's nothing. Taylor Swift has a good thing going for her. Eventually, she might be on my level. Yeah, we'll see, we'll see. But I was very excited to hear that, and so and I was even more excited to hear that once they decided that they wanted an internet comedian ophthalmologist to give the commencement address, they took it to the dean, and the dean at both schools didn't immediately shut it down, which is great. I feel like it was like 50-50. Like, you want who? Like the commencement address, that's when you get like famous, like accomplished people, like research people and like famous politicians and authors and stuff, not TikTok stars. But it worked out. It worked out okay. A couple things here. Preetam, you want to be a doctor? Good. I'm glad. I hope you do become a doctor. We need wonderful people to go out and take care of patients. Um, what do ophthalmologists do with people with Mobius syndrome? Oh, that's like a board exam question, and something I haven't thought about since residency. Mobius syndrome, I think it's a congenital disorder that affects eye movements. I think you have not able to look in certain directions, maybe eyelid issues. I honestly don't know. That's kind of pediatric ophthalmology territory right there. I'm going to defer on that. Thank you, voicing some opinions. Geek Sky, keep up the great work. Thank you. I appreciate that. I love some of my favorite videos, by the way, are the OR videos, the ones where it's a surgeon interacting with a charge nurse, anesthesia. Those are always, I love filming those because everyone loves making fun of surgeons. You guys, loves it. Even surgeons love to make fun of surgeons. That is why I love making those videos, because surgeons know they're not normal people. They're very strange, just overall. And so thank you all for those comments. What was I saying? So the commencement address. Yeah, I was very fortunate to be given that opportunity. I never thought, honestly. It's still somewhat surprising to me that I started telling jokes on Twitter as an ophthalmology resident back in 2016, and it just kind of gradually over time developed this following. And then what do you know? I'm giving commencement addresses to med school graduating classes with all the pomp and circumstance, and the thing with the robes and the hood, and the hat, which prevented me from being able to wear a bicycle helmet, unfortunately, on stage. I chose not to go on stage wearing my helmet, or dressed as any other character that I have, because it was already a bit surprising, and I'm sure the administration for both med schools were already a little bit nervous that this TikTok guy was going to be speaking at graduation. And so I didn't want to give them anybody on stage a heart attack by coming out dressed as uh, the neurologist. And mainly that would be bad because if someone had a heart attack on the stage, I'm an ophthalmologist, I wouldn't know what to do. And so I didn't do that. I didn't do that, but I did give both schools a congratulatory Jonathan head nod, which I think they did appreciate. Let's see, who do we? Dr. Bill, 2020. You want to see a LASIK surgeon? You're a LASIK surgeon. Well, I can maybe have the ophthalmologist do a LASIK themed sketch. That's a good idea. In fact, I haven't even thought about that. Maybe get into a little bit of ophthalmology stuff with the ophthalmologist and Jonathan. Maybe I'm sure we can pull Jonathan into LASIK in some way. I have to think on that. Good idea, Dr. Bill, 2020. Thank you. Yahusha's disciple. You graduated from OHSU in Portland. Paramedic. Thank you. I love paramedics are some of my favorite people because they've helped save my life in 2020 with my cardiac arrest that I had, which I say that really nonchalantly here. I realize a lot of you probably don't know what I'm talking about. That's a story for another day. All right. The other say about the commencement, the graduation, all that stuff. I love the comments, you guys. Keep doing it. I can't read them all now. I will sometimes go back and look at some of the comments that you guys put in here. I appreciate all the love, though. This is great. Will you ever see a plastic surgeon? I've got so many characters. There are characters I haven't pulled in for a while. I'll think about it though. It's on the list. And so thank you. Some of you guys want more neurology. Yeah, neurology is always there. Hi everybody. Someone from Australia. Great. Yeah, there you go. Okay, so the graduation at the Colorado graduation yesterday, a really cool thing happened. I got up on there at the lectern to give my talk, my speech, and I look out and there are 20 something graduates all wearing bicycle helmets. They put their helmets on. Those are all the graduates who were going into emergency medicine, brought their bicycle helmets. It was awesome. I hope that becomes a tradition, everybody. If you're graduating med school and you're going into emergency medicine, certainly wear the helmets. If you're going into neurology, use hair gel. I don't know, whatever you need. Get that hair up. All right. Put the glass, wear the Phi Beta Kappa tie. Let's see what else. And everybody work on your Jonathan face because everyone loves a good Jonathan. Anyway, I love the unicorn headband. I bring this on my speaking trips. I bring the unicorn headband. Here it is. This is the new and improved, updated version of it. I'm going to wear this for a while because pediatrics is the specialty of honor for this live. I know the thumbnail for this was the neurologist just because I don't have a pediatric picture, but the pediatrician is the specialty of honor today because they are fierce defenders of children. And given the events that happened in Texas, I want to give a shout out to pediatricians because they are constantly advocating and fighting for the safety of children and trying to make the world a better place. And we all can look to them as an example of how to advocate for people, from doctors, from everybody, non-medical people. We need more child advocates. And so not advocates that are children. They can be advocates too, but advocates that advocate for children. I get that was a confusing way of saying that. Anyway, shout out to all the pediatricians out there. I also want to say, last thing about more nurses. You want more nurses? Okay, the charge nurse is probably going to be your only nurse. There's a lot of different nurses and a lot of different specialties, but I'm only one person, even though it seems like I'm like 50 people at times. And so, yeah, but the charge nurse is a great character. She's got the hat, fantastic. I feel like I've really nailed the charge nurse mentality. A little bit scary, but also very good at her job. So anyway, the uh, so what I was going to say? The last thing about the graduations. And before I do that, there's a couple of. Let me get to these. Dr. Billard. Brianna Kuzo. Um, you want me to buy my daughter's ice cream? I'd love to. They would love that. I will. I will absolutely do that. Thank you for that. And it is sometimes it's that easy to make a child's day, right? Is just ice cream, unicorn headband. It doesn't take much to give a child a smile. And so with the graduation, the other thing that was really um, uh, wonderful to see is just how just hearing the graduates talk. So I heard at Yale, I heard a graduate speaker, a student speaker, a graduate came up and gave us a speech, talked about reproductive freedom, talked about just nurturing the patient-physician relationship, and then at Colorado, same thing. Talked a lot about just what it means to be a doctor. I was so impressed by all the speakers, all the students that I met and talked to. They're just you guys are with it. You know what you want, and you may not know exactly what you want to be eventually in your career in terms of fellowship or whatever it is, but you know the problems out there. You recognize the things that need to change in healthcare. You have that vision already, and I didn't. I was not as sophisticated in that way as all of you are graduating today, and coming up as the next generation of doctors. It's just wonderful to see. I was inspired by all of you. Hopefully, I inspired some students with what I was saying, but I was inspired, and so keep that fire going, all of you. Hopefully I can help by showing you some of the terrible things that we need to change with regard to insurance and private equity and healthcare and all the stuff I talk about. And so just keep it going and keep that mentality of not being complacent and recognizing that we need to make things better in healthcare and medicine, just across the board. So I was just very, very impressed by all of you. And there's a lot of really good people going into medicine, becoming doctors that are going to do amazing things. So well done to all of you. Let's see. Let me check in here on the chat here. Um, voicing some opinions is back. Hi, you're an SLP, a speech language pathologist. Would you ever have an SLP? You know what? Because I have the OT, PTOT, who have fallen in love and are developing a beautiful relationship with each other. And so I have some ideas for how to incorporate a speech language pathologist. One idea is that one thing we haven't seen PT and OT go on a date. And so I thought maybe they go on a date, go to a restaurant, and their server is a speech language pathologist, because you deal with a lot of like swallowing difficulties, right? Like I feel like that's a thing, or like just mouth, throat. I don't know. I'd have to do some research, because you guys, I'm a I am a path. I am not a pathologist. I am an ophthalmologist, and I do have to do some research, because the farther out I get away from general medicine, the more all that knowledge escapes my brain, and I have to rely on all of you and all the things that you complain about and talk about on social media to remember all the medicine that I have since forgotten. Because and one thing I told the graduates is the first thing, really the most important thing, once you become an ophthalmologist, once you graduate and enter into ophthalmology residency, the number one priority is forgetting everything you learned in med school. Yeah. You don't need it. That's the thing. You don't realize that because I haven't thought about like cardiovascular physiology in like 10 years. Yeah, it's not important to me. Um, so someone says, what about dentists? I have a fantastic video idea for dentists. The dentist will make an appearance. I promise you. I am very excited. As soon as I get a chance, I will be recording a video that features a dentist. Stay tuned for that. I'm very excited about it. It's gonna be pretty funny. And the difficult thing is that, and the reason that I don't feel like I've been posting as much the last couple months, and that's because spring is very busy when it comes to speaking. So I do a lot of speaking. I go to a lot of conferences, the commencement addresses. There's always a couple of those in May. And so it does take a lot of time to put together presentations for these things. I love doing it because my background is in stand-up comedy. I've done stand-up for I don't do it anymore, but I did it for quite a while. And so I love performing, and so I love to go to conferences and events and speak. And the spring is just very busy. So I'm hoping to get back and record. I've got like a dozen ideas of what to do. So what I want to film. So stay tuned. Simrat, let's see. You love the academic journal sketches. You want to see a sketch between neurologist, psychiatrist, and neuroscience. It's neuroscientists collaborating on a project. That is way too much brain power in one room. That's a lot. But I do the academic journal stuff. I love doing the academic stuff, and I've gotten good feedback on it. It's I like finding the topics that where people are like professionally taken advantage of, I guess. And I feel like that happens a lot in academics. You give so much of your time for this promise of prestige and resume building, and it's not always actually basically I think people should get paid for the work they do. That's kind of how I feel about it. Let's see here. There were a couple other, I think I missed a couple of those super chat comments, but let's see. Who else? What else we got? Commenting capstick. As I told you, it's like the whole thing is just dry. I'm like the moisture again being sucked from my body here in Denver, Colorado. It's I may not survive. We'll see. I don't know. A skit on I've done a couple skits on match day. You got to keep up. Okay. I can't keep up for you. You gotta pay attention. Look, see what's out there. See if I've done it before. It's I'll remind you. Let's see. Collaborations. Collaboration. I'm not big on collaborations mainly because my schedule is so insane that it's really hard to find time to do that. So I appreciate that thought. Jonathan Goes to Therapy is something that I will be doing. That is on the list. I promise you. I've got some good ideas for that. Pulmonology. I'll think about it. So what do I have coming up? Let's see. I am going back to my residency alma mater, the University of Iowa. I'll be there in June. I'm very excited because it's a big get together with a lot of people that had a big impact on my career in training me to be an ophthalmologist. I'm going to give a talk / roast at a big banquet that they're having there. Very excited about that. Taking a big family trip to Italy in July. I'm speaking at a conference out there. So it's very exciting stuff. Never traveled that far with 2 small children. And so that'll be an adventure. If anybody has any tips for going to Italy, I've never been. I'm excited about it. I do have a Jonathan, and my Jonathan is fantastic. And the thing is, once you start working with a Jonathan, you can't not work with a Jonathan. Jonathan is permanent. You just it's a in fact, I will be doing a video at some point on the origin of Jonathan. Where do Jonathans come from? Where do they live? How do you find one? How do you gain a Jonathan's trust? And basically just like a manual for Jonathans. And so I think that'll be very helpful to probably no one, but it's a thing I'm going to do. Let's see. Get get pizza in Italy. Parker, great advice. Thank you. I think I'm all set for Italy tips, you guys. I'm going to get pizza. That's it. That's good. I love it. Pizza. I will honestly, I will get pizza. That's a great tip. Family medicine deserves a Jonathan. Completely agree. Completely. In fact, I think didn't we just have like a family medicine doctor, like World Family Medicine Doctor Day? Maybe maybe that's a good reminder for me to reward family medicine with a Jonathan. So that's a great idea. Thank you. Let's see. Let's say we'll do a couple more minutes. I'll keep looking at the chat here, see if you got any other thoughts or questions or anything. Oh, my hair looks great. Thank you. It's like 50% neurologist right now. It's called see us for the neurologist. You just gotta kind of do this. And so yeah, thank you. I appreciate it. I saw someone commented earlier that it's hard to they don't know if the neurologist and the nephrologist are two different people. I think the nephrologist, it's true because they both wear the same pair of glasses. The nephrologist, which I will be doing a nephrology and cardiology go to therapy soon. I did the joint therapy session, the couples therapy basically with anesthesia and surgery. I'm going to do the same one with cardiology and nephrology. The big difference is the neurology has the nerdy nasally voice with the tie. Nephrology is a little bit more mean. Just they're both kind of mean. Nephrology and cardiology, they're kind of mean in a really nerdy way, and the things they care about nobody else cares about in the world, and I think that's why it's funny. But anyway, yeah, nephro and cardio, get ready. I love everybody's got their favorite characters, and I try to be cognizant of the fact that I need to keep them in skits, and so if you haven't seen your favorites in a while, don't worry. I know who hasn't been there in a while, and I'm gonna keep incorporating everybody. Again, it takes time. It's time intensive doing all this stuff and writing the skits, and I have a very high standard that I keep for myself in the videos I do. I will not post something that I don't think is insanely funny. Now, whether or not you find it funny, yeah, I don't know. Only you can tell me that, but I will always do my best to give you guys really good content. And Tina on Earth, the Peds sketches. You should go to Peds. You guys, can everybody be? If you're not going to be an ophthalmologist, then you have to be a pediatrician. Those are the rules. I'm sorry, that's the only thing. You can also do family medicine. Those are the only options available anymore. That's it. That's all you can do. Either eyeballs or pediatrics or family medicine. Okay. So anyway, I'll end on that note. You guys, thank you for being here. Sorry it's been so long since I've done this. We will. I'll try to do it more often. Maybe I tried initially to shoot for like every 2 weeks. I think I was a little bit ambitious with my schedule. So maybe once a month is probably a little bit more realistic. But anyway, I will be back. Again, thank you all for being here. I appreciate you and for watching the videos and sharing with family and friends. And I wouldn't be here if it wasn't for all of you. And so the love I get from this community is really just amazing. So I appreciate you and wish you all the best. Take care.